Have you seen the changes in brain by way of MRI before, stroke, before physiotherapy, after physiotherapy?
Yes, I have seen it. Because the neuroplasticity. Yes, neuroplasticity. See, in stroke patients, it's a research-based thing. The first 6 months are very important. The recovery is 80 to 90%. After that, it becomes a chronic case. So the recovery is very slow. So the brain reacts to the therapy and everything in the first 6 months. So it's very important. You shouldn't be waiting even for a day. You should absolutely get back. And I've seen stroke patients, you can see them walking around and realize they had stroke. And I'm talking about even a 79-year-old man or even a 45-year-old man. Both of them.
You handle them?
Yes, I handle them. I have a 79-year-old man got a stroke, and on the 7th session, that is the 4th week, I don't even do therapy every day. Because you need to give the muscles time to realize, understand. It becomes too much for the body to take. So in the 4th week, that's 7th or 8th session, he was walking down the stairs and up and about. It's just about targeting the goals and just going ahead with it.
So many of our viewers must be probably listening for the first time. Physiotherapists training brain as well.
Yes, so I always say that when we train stroke patients especially, you can, they have forgotten, the brain has forgotten that they has to, it's example, you lift something, they've forgotten it. The only thing is that the brain is giving signals, the arm is not understanding. So what I say is, you make them do it again and again with conventional therapies, or we have a lot of technologies and robotic arms and everything we have now. So we do that, and what we do is, when they're doing this, it's sending signal to the brain and saying, this is possible, and the brain is changing its signals, and that's how it happens. That's exactly how neuroplasticity works, and it's a very proven thing.
Okay, you did your masters in UK, and while doing your masters, you worked also.
Yes.
What difference do you see? Practice of physiotherapy
over
here?
Yes. So when I was in Coventry, is my university that I studied, we were allowed to observe patients, neurotherapy patients, and we were gone to the hospital to see. I will just give an example. When I was here, we were, if we have a paraplegia patient, we were 4 physiotherapists, lifting him to get up. He was a 6.2, 6 feet tall man, 24-year-old with TB spine, and was paraplegia. So we used to lift him up, 4 people together. It was very difficult. The patient is so not confident. We're touching him from everywhere. It's very difficult to, train such people. Whereas in UK, when I went, they have a suspended harness. Just put them, and they're doing all the activities. Patient is confident. That's the first thing. You need to make them very confident that yes, they can do it. Balance training was easier. It's very goal oriented. You explain to the patient. You are not in a hurry to really have the next patient. You take good amount of time with the patient. It's not about the 45 minutes you spend with them. It's about the small goals that you need to achieve in every therapy. It can be the smallest of the things, that picking up a glass. And if the patient can pick up a glass, you just put little water and say, oh, you can pick up a heavier glass than yesterday. It's about small goals that you need to achieve when you are doing therapy. Let's talk about orthopedic also. When the patient comes in, you have so many therapies that are coming, small courses, and so which therapy to use? you are shocked. I mean, if somebody comes with a low back pain, you're like, there are so many. Example, there is Maitland, there is Mulligan's, there is Mackenzie, so many things. What to use for what? When I was here, whatever I felt and whatever I knew, I used to use. Jo aata hai, let's do it. But when I went there was a reason to use every therapy. Why are you using it? There is clinical evidence. It's evidence-based practice. It has to make sense what you're doing.
And
that's how
strong documentation system.
Extremely strong. I cannot just write anything and get away. You have to write each assessment. The patient comes the next. It's not only about the first day. It's about the second day also. And the biggest challenge that I face that the doctor which shows me 10 exercises is better than the doctor who shows me 2. That also I found the biggest difference. It's you need to trust your physiotherapist, and you can go and ask them that what is the problem with me? Why am I doing this? That's also there. So that is another thing. Another option that I would say, that another thing that I learned was, there are, we call the patients, I see that, the people who send over patients, example, if they send, they write things like, do this, do that. But I feel that a physiotherapy is an independent profession and they can decide what to do. It has to be, get the patient fine. That's it, that's the idea. You should just trust the physiotherapist and let them do their job. Calling the patients 15 days in a row is not going to solve the problem at all. If it's a back patient, strength of the back takes at least 6 to 8 weeks to get from one grade to the other. You have to wait that much time. You have to be very careful. And whereas in UK we have only 6 to 8 sessions for acute cases and they're solved. And they don't even call them every day. It's all at least twice a week and then it's just done. And that's exactly how it is to be treated. You need to do your home program. You need to be dedicated. The physiotherapist is not the only person who is responsible for your pain. You have to be as dedicated. Listen to their instructions and just trust them. Everybody, from the patient also and the people who are sending us.
Okay. So 3 things I would remember. Huge difference in quality, evidence-based practice, and strong documentation.
Yes. These are the 3 things I would say.
Okay. Now, you're practicing in India.
Yes.
To your mind, which direction this profession is heading towards?
Okay. So we've spoken so much negative about it, but
I don't think we spoke negative. We spoke what it is.
It is.
So
but I feel that in some part of the society, perceptions are changing. My idea would be that if you have a lifestyle issue like a back pain, you've been going to the office all day, you are, you know that you're having neck pain, your upper back pain, sedentary lifestyle. If you have a pain, you have an issue, you're directly going to come to a physiotherapist. That's what I see. Instead of going to, different other specialities, you would definitely come to a physiotherapist because we are the movement specialists, as I said. You want to do something better instead of popping a painkiller or doing 100 tests like an MRI, X-ray or whatever. Trust me that clinically we can see much more than what an X-ray or MRI tells us. So I would say that come to us, and that's what I see that profession going ahead. That all these lifestyle issues can be solved by the physiotherapist, and I even feel that we do not need any referencing. People come directly to us. So that's what I feel, that it will be going ahead in that direction.
Well, in last few months I met some young physiotherapists and I believe in what you are saying. At the same time, level of awareness is too low in our society. So what are you doing to...
So I am going to be starting to write blogs. I'm going to be on Instagram.
Apart from this interview?
Yes. So I'm going to start writing blogs. I have written few blogs. I'm going to be publishing it on my website soon. I will be on Instagram because that's where most of the young people are. You need to target where they are. And having probably camps, getting aware and going to clubs or all these places where you have a lot of people. Because awareness is very important. I have seen so many things going wrong that, not mentioning, but it's just that it's very sad where people are gone through wrong path just for a small injury, and it's not even been solved. So they should just trust the physiotherapist, and yeah, that's what I think it is about.
And of course, you could join hands with Fitnessity. We are here.
Yes, of course. It has been a pleasure, with Fitnessity, because I think the time I met you, I knew I'm meeting someone who knows what they're doing. Because it was a very shocking thing when Fitnessity wanted to join hands with a physiotherapist, because you think of fitness and you just think of people with training or whatever, strength training, gym trainers, and these kind of things. We are not even considered. But I'm very happy that we can be a very major role in fitness. We can prevent injuries. We can help you solve your issues and still do the job. I have never told my patients, do not do this. If there's a housewife and she says, I love swimming, I'm never going to tell her don't swim because of your posture or anything, because that gives her happiness. We are here to make sure that all the movements done are done pain-free, and that's what we are here about.
Superb.
Yes.
Nice talking to you.
Thank you so much. Thank you so much, doctor.